Hello. Welcome and good afternoon. I am so grateful for everyone joining us here today. My name is Kendall Lee. I am the program administrator for the EPN for those new faces here in the audience. And the EPN is a communication network operated by the Maryland National Capital Home Care Association, or MNCA for short, in partnership with the Maryland Office of Preparedness and Response in our state health department. And what we do is we provide emergency preparedness training, education, and resources to those in home and community-based healthcare, which includes, but is not limited to, the patients themselves, their providers, and their caregivers. All of our work is made possible through MNCA and OPNR. And so with that, I would like to thank the Executive Director, Caitlin Howe of MNCA, who is joining us here today. Hi, Caitlin, and the folks over at OPNR. Welcome everyone to our second lunch and learn session. I'm so grateful to connect with you here today, again, over the lunch hour to share about such an important topic that's always relevant, but particularly now as we enter respiratory illness season: infection preparedness. Can't wait to introduce our guest speakers to share with you about all the accessible infection control education and training that Maryland Project Firstline offers. But before I do, I'd like to cover a few housekeeping items. This webinar will be recorded, so after it's complete, we will share this information with you soon following the event. And additionally, this recording will be made available through our channels via YouTube and on our website. And we welcome you to revisit this and share with your friends and colleagues. For the audio portion of today, you will have complete control over your mic, but we do kindly request that you remain muted while speakers are presenting. So if everyone could please just ensure that you are muted at this time, we very much appreciate it. For the camera portion of today, you are not required to turn on your camera, but we invite you to do so to connect with the audience and the presenters. And then for the Q&A portion, so we welcome and encourage questions throughout the entirety of the presentation. We have someone with us today that I will soon be introducing that's going to be supporting with the Q&A. There will be a dedicated portion at the end of the presentation, but again, the questions are welcome throughout. So please submit your questions via the chat box, and the speaker will respond to them at the end of the event. So without further ado, we have with us today a terrific trio that's been such a pleasure to work with: Diane, Lynn, and Elena from Maryland Project Firstline. And at this time, I'm going to hand the floor over to Diane and Lynn to begin the presentation. Take it away.
Okay, thanks, Kendall. Can everyone hear me okay? I had to take off my headset. It started giving me some problems. So are we okay? All right, thanks, Kendall, and thank you for inviting us today. We wanted to provide an overview of the free infection control resources that are available to all healthcare workers and environmental services staff in healthcare settings in Maryland. Project Firstline is a nationwide CDC initiative that provides innovative and accessible infection control education for all frontline healthcare workers, including environmental services staff in healthcare settings, so they can protect their patients or residents, their coworkers, and themselves from infectious disease threats in healthcare. As a collaborative, Project Firstline brings together more than 75 healthcare, academic, and public health partners to reach a wide range of healthcare audiences and settings across the country. These include state, local, and territorial health departments, numerous community colleges and universities, and many professional organizations. The program offers free educational resources in a variety of formats to meet the diverse learning needs and preferences of the healthcare workforce. Resources are designed using adult learning principles, educational best practices, CDC recommendations, and the science that informs them. Maryland Project Firstline is administered by the Maryland Department of Health and Health Quality Innovators. As I mentioned, Maryland Project Firstline is intended for all healthcare workers and environmental services staff in healthcare settings throughout Maryland. This includes students in allied health science programs who can supplement their existing infection control training prior to entering the workforce. We all agree infection control is more than just procedures. Understanding why we perform these procedures will help reinforce the concepts and better prepare staff as they care for patients and residents. Although the training content is very fundamental and most experienced workers will have heard it before, it is a reminder that the basic infection control principles are important in our everyday tasks. The CDC put together a brief video about Project Firstline, so let's go ahead and watch that now.
Working on the front lines of healthcare, you have experienced the realities of the COVID-19 pandemic in ways few can understand. You're working harder than ever to protect your patients, coworkers, and yourselves, and you deserve infection control education and training designed just for you. That's why we developed Project Firstline, because preventing infections is a top priority for everyone. It's why you train, it's why you prepare. It's why you work together as a team. If you stay vigilant and take action to stop the spread of germs, with every person, every action, every day, you make healthcare safer for your patients, your coworkers, and yourself. Project Firstline is here to support you as you learn and train. We have the power to stop infections together. We have the power to save lives. Project Firstline offers free infection control training resources developed with healthcare workers for healthcare workers.
CDC developed training materials cover 17 infection control topics that can be delivered as individual topics, or several related topics can be combined into a course. We offer a free online learning management system for individuals to take the training courses when it is convenient to them. We literally have learners online around the clock. We also offer group training sessions, which we can deliver in person, or we can set up a virtual session for your team. The team hosts webinars each month. Most are about 30 minutes, and our schedule is on our website. You can ask to be added to our email list to receive the monthly newsletter with the webinar schedule. And if you prefer to deliver your own training to your staff, we will send you all the materials you need for the topics of your choice. So these are the first 15 topics that are available and which were developed at the beginning of the COVID-19 pandemic as a tool to reinforce infection control knowledge quickly and consistently. These topics are all contained in courses on our learning management system and are presented in webinars throughout the year. Diane will conduct a source control training in just a few minutes, and this will give you a good sense of how all these topics are presented. We also have several interactive modules that the CDC developed more recently to focus on general infection control practices, such as recognizing sources of germs and how they can be spread in healthcare settings. The CDC just released new micro topics that we will be sharing in the next few months. These are designed to target a specific topic in a short amount of time, such as during patient huddles or other brief meetings. I mentioned that there is a learning management system for Maryland Project Firstline. We'll put the link in the chat, and you will just need to provide an email and password to set up your account. You will then have access to all of the courses. All the training content is available in English and Spanish. The Spanish courses contain videos that have been voice-overed so that the learner can hear them in Spanish, plus all the written content was translated into Spanish. We have hosted Spanish webinars on several topics, including environmental cleaning and disinfection, and those recordings are currently available on our learning management system. We also have translated materials in 4 other languages, topics 1 to 5, covering basic infection control, the science of viruses, and the spread of COVID-19 and other viruses, are also available in Chinese, Haitian Creole, Russian, and Tagalog. The videos were voice-overed in these languages as well, so I'd like to show you a clip on how those turned out.
Hola a todos, soy Abby Carlson. Soy médica especialista en enfermedades infecciosas aquí en los Centros para el Control y la Prevención de Enfermedades en Atlanta, Georgia.
Kumusta kayo? Ako si Abby Carlson. Isa akong doktor na nakakahawang sakit dito sa Centers for Disease Control and Prevention sa Atlanta, Georgia.
Всем привет! Я Эбби Карлсон. Я врач-инфекционист Центра по контролю и профилактике заболеваний в Атланте, штат Джорджия.
Bonjour tout le monde, moi c'est Abby Carlson. Moi c'est un docteur spécialiste dans maladies infectieuses ici là dans Centre pour contrôle et prévention maladie dans Atlanta, Georgia.
大家好，我是 Abby Carlson， 我是佐治亚州亚特兰大市疾病控制与预防中心的一名传染病医生。欢迎来到 Project Firstline 培训项目的视频博客。
So that was fun. I'm a big fan of Dr. Carlson, so I really enjoy that video clip of her speaking all the different languages. So we selected these languages based on the most commonly spoken languages in Maryland, and we're really pleased with how the videos turned out, as well as all the course content that is now available on the learning management system. Next slide, please. Our incentive program is very popular. If you complete all 17 topics on the learning management system, including all the feedback forms for those 17 topics, you will earn a $50 Walmart e-gift card. For every feedback form you complete for any type of training, whether you attended a webinar, completed an online course, or participated in an in-person training, you will be entered into a monthly random drawing for a $25 Walmart e-gift card. Next slide. Thanks. Continuing education credits are available for physicians, physician assistants, pharmacists, registered nurses, and advanced practice nurses. These are all available through the CDC's training and continuing education online site. So we'll put the link in the chat for this site, and we're available to help you work through that process if you're interested in the continuing education credits. Next slide, please. 4 of the topics are now available as an escape room experience. Brief training is provided prior to beginning the activity. Participants work together in teams to solve puzzles in the topics of hand hygiene, source control, PPE, and cleaning and disinfection. We recommend selecting 2 topics for a 1-hour session, and 2 hours are needed to complete all 4 topics. Multiple days may be scheduled to offer all 4 stations or to accommodate all staff. Next slide, please. All right, we're just going to watch this video real quick. This is another fun one. So as you can see, the escape room is much more interactive than your traditional lecture format, and it's very popular as a result. Many of the facilities are providing lunch for their staff after we finish, so that is another way to make this a really fun training experience. I know I covered quite a bit of information this morning, but you can go to our website, mdfirstline.org, and find all the details that you need, as well as sign up for our mailing list to receive our newsletter and webinar schedules. If you'd like to put your email in the chat now, we can go ahead and add you to our mailings. We have a newsletter that'll be coming out at the end of the month. And also feel free to put in any questions that you might have with the material that I just covered, and we can address it after Diane finishes training on source control. So Diane, I'm going to turn it over to you.
Thank you, Lynn. And I would like to welcome everyone in our audience to Maryland Project Firstline training. Our topic for today is source control. This training is part of the CDC initiative to provide free infection control training to all healthcare workers in Maryland. This presentation follows the same format we use when we are doing a virtual or in-person training. We will begin with our agenda. Our agenda for today will focus on the learning objectives for this topic. We will discuss what is source control and why it matters. We will also discuss how can masks stop germs at the source. We will do a quick review of key messages, and then we will answer any questions you might have. Here is what we expect to learn today. After today, you will be able to explain how source control keeps germs from spreading. Source control is about stopping germs at their source before germs can spread. Also, we will discuss one reason why source control for COVID-19 focuses on masking. Let's first begin with the definition for source control, which was provided by the CDC. Use a well-fitting cloth mask, face mask, or respirator to cover a person's mouth and nose to prevent the spread of respiratory droplets when they are breathing, talking, sneezing, or coughing. A mask should fit well without gaps at the edge or the chin and should cover your nose and mouth to prevent the spread of respiratory secretions when someone is talking or breathing out. This way, the mask can block respiratory droplets that are released into the air. Now, we will check in with the CDC's Dr. Abby Carlson to learn more about source control and why it's needed in healthcare.
Welcome back, everyone, to Inside Infection Control, our video series here at CDC's Project Firstline. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's great to have you with us. We have talked in previous episodes a lot about the different actions that we can take to keep germs from spreading, in healthcare in particular. And source control is one of those important actions. But what exactly is source control? It's a concept that we come back to a lot because it's that important, and it starts, not surprisingly, just like its name, at the source. You're stopping germs at the source before they can spread to other people. We talk about source control as an important tool for COVID-19 to reduce the spread of COVID-19 and other diseases that travel in respiratory droplets. And we're going to focus on that today. But keep in mind, source control is important for a lot of other diseases too. One example is shingles. We cover the spot where a shingles rash is, which keeps virus from getting from the rash into the air or onto other surfaces in your environment where it can spread and it can infect people. That's source control for shingles, covering the rash, the source. In COVID-19, source control focuses on covering the nose and mouth to keep your respiratory droplets out of the air, because that is the main way that the virus that causes COVID-19, SARS-CoV-2, gets from person to person. Masks that fit snugly around the cheeks and our chin are the main way to do source control for COVID-19. A mask that fits well covers your nose and your mouth and blocks those respiratory droplets which are traveling in the air when you breathe and which have virus in them if you're infected. This means that those droplets, when they're covered up with that mask, are much less likely to reach other people around you and then infect them. And if you're caring for a patient with COVID-19 and you're using an N95 respirator and not a mask, most N95 respirators that we use in healthcare are also good at blocking your respiratory droplets from breathing out into the air. So with most N95s, not only are you protected from the virus that your patient is breathing out, but your patients and your colleagues, if you're infected with any virus, are protected from germs that you might breathe out. All of this source control is important for COVID-19 because we don't always know who's infected. Other source control methods, like in the shingles example, depend on knowing that the patient is infected and knowing what to do. For example, covering a wound because you've seen it, you know it's there. COVID-19 is different because we have patients who are asymptomatic, which means they could be infected, but they may not show it yet, and we may not be aware that they or we, if we're infected, can spread the virus to others by talking, breathing, singing, and other activities that use our breath. We'll talk more about this in another episode, so please stay tuned for that, because asymptomatic transmission, asymptomatic infection, it's an important thing. But this spreading of infection when you don't have symptoms, it's one of the biggest reasons we have everyone wear a mask that fits well when they're in the healthcare setting, and also when you're out in the community. So you can see why source control is an important tool in healthcare and in the community for stopping the spread of COVID-19 and other diseases that travel by respiratory droplets. As always, thanks for joining us. Please be sure to follow up with us on Facebook, on Twitter, we're on YouTube, and of course we're on the web, cdc.gov/Project Firstline. We will see you back here for the next episode.
Okay, so to review a couple important tips. For COVID-19, source control focuses on covering your nose and mouth with a mask to keep your respiratory droplets out of the air. This matters because we've learned from Dr. Carlson that one of the main ways SARS-CoV-2, the virus that causes COVID-19, travels between people is through our respiratory droplets that come out when an infected person talks, breathes, coughs, or otherwise blows out air through their nose or mouth. Basically, when we stop those respiratory droplets at the source, we keep the virus from spreading. However, we don't always know who is infected. Since we don't always know who is infected, people who are infected with SARS may not show symptoms initially and may not be aware that they have the virus. This matters because those that don't know can infect others, which is why source control for COVID-19 is very important. Let's discuss a few source control tips for masks. It is important to wear a mask that fits snugly around the cheeks and chin without gaps at the edges. Your mask should fit well, without gaps, and it should cover your mouth and nose. This makes it less likely for your respiratory droplets to reach other people and things around you, as well as making it a source of protection for you. In addition, source control tips for N95. Most N95s used in healthcare are also good for source control because they block our respiratory droplets from being breathed out. In addition, most N95s also block your respiratory droplets from being breathed out into the air. I hope these tips gave you some good information about source control. Now, let's review a few key messages. As we discussed and we learned from Dr. Carlson, Source control keeps germs from spreading by stopping them at the source before they can spread to other people. In addition, source control is an important tool to reduce the spread of COVID-19 and other respiratory infections, as well as other diseases. For COVID-19 specifically, source control focuses on covering your nose and mouth with a well-fitting mask to keep your respiratory droplets out of the air. And as we know, most N95 respirators used in healthcare not only protect you from viruses that your patients may breathe out, but also protect your patients and colleagues from germs that you might be breathing out. At this point, that concludes our presentation on source control. After review of this topic, does anyone have any questions regarding the training on source control or questions regarding Maryland Project Firstline? Feel free to put your question or comment in the chat, or you're welcome to unmute yourself.
I have a question.
Yes.
My question is about the newsletter. So the EPN does receive communications from Project Firstline, but I'd love to have you share a bit more about how someone, if they're interested, signs up for the newsletter, and then in these newsletters, what is being shared to the community.
I can go
Great
ahead and answer
question.
that.
Okay. Go ahead.
Yeah, so if you put your email in the chat, I am keeping track of those, and we will add you to our newsletter list. So the newsletter goes out at the end of the month, each month, and we just started, I believe in July, putting together just what's going on and where are we going to be and how do you reach us, that kind of information. We usually include a fun fact or two. We'll put some pictures in when we go and do in the field training with in-person escape rooms and that sort of thing. We may take pictures. We always ask permission and get a signed release, but we'll share those in our newsletter just so you can see how much fun everybody's having and what kind of facilities are asking for the training. So you may, identify, hey, there's a little practice with only, 6 people, 7 people, and they're getting trained by Project Firstline. So it gives you everything that we're working on, anything that's new. If we have a new resource, we'll put it in the newsletter. So it's a really good way to stay connected to Project Firstline.
Great question. Thanks, Kendall.
You're welcome. I have another question.
Sure.
About the trainings. So yes, to confirm, you provide in-person trainings where you can come out and teach, such as you did today, but also virtual trainings for those that are interested can access online at no cost at any time. My question is about the in-person training. So you can come out, but you also mentioned that if they're members of an organization that's interested in hosting the training themselves, you can provide them with the materials. I'd be curious about particularly the escape room that looks so fun to be in. Is that something that someone themselves could do as well?
Well, the way the escape room is set up currently, we are only able to do it in person.
Okay.
We are, along with the other state groups that we're working with, the other states do have Project Firstline as well. We're looking into a virtual option, but right now there is not one. However, there's a virtual option for any of the topics, an individual topic or a few topics combined. So
we're not able to provide materials for the escape room.
Right.
It's it takes a lot of practice
and setup
to do that.
Yes.
Right. Yes. And teamwork that I would encourage to do in person. That one looks so much fun. Yes. And just to remind everyone, in the chat, there was a question about if you're interested in either hosting or participating in a training, how to go about doing that. And Lynn put in the email that you can contact them directly, MD Firstline at HQI Solutions, to do that. And there's also right below that a request form for training as well, if you're interested, just as a reminder to everyone.
Yeah, and Kendall, we are looking into the possibility of having like local health departments or some of the other
Okay.
larger organizations like Lifespan or
Mhm.
anyone who has a larger facility where we could perhaps in the new year schedule an escape room so that, you know, our individual learners who may not be associated with a brick and mortar type of building,
That's great.
our
That's great.
healthcare workers,
Mhm.
that they could sign up and actually attend like an escape room session.
I want to do that.
Count me
Count me in
to
my
open
free
that up.
RSVP. Thank you for sharing that. It's very helpful, I think, for our audience.
Yeah, stay tuned, watch our newsletter because we'll put the information in there once if we're able to offer it that way.
Yes.
All right. If there's no other questions, we'll proceed to our next slide. Please follow us on Facebook or X as we post updates approximately 5 times a week. If you do have questions or need to get in touch with us, please feel free to send us an email at mdfirstline@hqi.solutions, and that email is in the chat. Please sign up for our monthly newsletter. As Lynn discussed, all the updates we provide about Maryland Project Firstline. There's also information about our learning management system and free infection control training opportunities we offer. You can also put your email address in the chat, and we would be glad to add you to our email distribution list. The CDC Project Firstline Infection Control Training also offers a certificate of completion for each course you complete and will send it to you after the session, usually within a week or 2. If you take a course on our learning management system, a certificate will be generated through the system and available to you for download. This is an example of one of the certificates. Finally, please let us know how you enjoyed today's session by completing a feedback form. We would be very much appreciative if you could complete the feedback form for the source control training that we provided today. You can access the form by scanning the QR code on the screen, or we also have a link in the chat that will take you directly to the feedback form for this topic. And the topic is source control. And as Lynn mentioned earlier, we do offer the incentive program. So anyone that does complete the topic today, as well as the feedback form, your name will be entered into our monthly drawing, which will be November. We conduct the drawing the first week of December. So once we have all the feedback forms and we pull the report, and we select a learner of the month who will earn a $25 Walmart gift card. On the other hand, if you go to our learning management system and you complete all the topics or you attend our webinars between the learning management system and the webinars and you complete all topics, we'll pull the report for that. And once you do complete all 17 topics and a feedback form for each topic, you will be eligible for the Walmart $50 e-gift card.
I have a question.
Sure.
How do you go back to the other topics?
Are you familiar with the learning management system? Like, are
Yes.
you okay? So if you have a login and a password, you would just go into the system and there is a course for each topic. So topic
Okay.
1, 2, and you don't have to do them in any order. Sometimes people will do them with the preference of what is occurring at that time in their facility.
Is that I'm sorry. Is that
No, go ahead.
this TCR or something? I had it written down.
Yeah, the TCEO, that is for nurses, advanced nurse practitioners, physicians to obtain the credits.
Okay.
And that is a different site.
So I have to go to the, so I have to go to the learning management.
You go to the learning management system, and I believe the link is in there. It should be in the chat.
Let me see. I think I did see it.
Yep. Alina just put it in there
Okay,
again.
yep. Thank you, Alina.
Yep. Yep. So if you go there, once you set up put in your email address and a password, and they don't ask for any other information. You just need that.
Okay.
You can take those courses anytime, day or night, and then we'll pull the next time we'll look at them. We just finished the October courses. So for November, the first week of December, we'll look to see, and we pull the reports to see who finished all the courses. And then we
Okay.
contact you and let you know if everything's complete. And then we just need you to verify the place that you are working at and what type of healthcare worker you are and an email address so we could send you the Walmart gift card.
Okay. Well, I'm not,
Okay.
I work with the state of Maryland, the health department. So I'm
Okay.
not considered, I'm a child member. So what happened, my supervisor asked me to just listen on to see if it was any information that was useful for us.
Okay.
So
Well, I hope it was.
it was, well, most of
Oh,
the
good.
stuff with the COVID, that's because I work in the COVID department.
Right. Okay. Right. It's a pretty basic review,
Okay.
but we hope that it is helpful for you. As
Yes.
Kendall said, as we're moving into respiratory season, it is a good reminder.
Yes. Thank you so much.
Sure. Thank you for joining us. Do we have any other questions about our training, about the topic? Any comments? We enjoy the feedback. It does help us prepare. So feel free to put any comments you have in the chat. Okay, if there are no other questions at this time, on behalf of Maryland Project Firstline team, Lynn, myself, our manager, Jennifer, and Alina, we would like to thank the EPN for giving us this opportunity to educate you on Maryland Project Firstline. Kendall, it has been a pleasure working with you preparing for this webinar. Thank you to everyone for attending this informative webinar and training session regarding Maryland Project Firstline. And if there's any other questions, we'd be glad to answer them.
Thanks so much, Diane. I am going to close this out today. It has been such a pleasure working with all of you. Thank you so much again to our wonderful guests at Maryland Project Firstline. If you are looking to sharpen your infection control knowledge and skills, they are the resource for you. That again is no cost, but definitely worth investing in. If you have any questions, you're invited to contact them directly at the email address that they provided in the chat. Any questions that are not answered today, though, will be provided to them directly, and they are wonderful at following up on those directly. Look forward to the webinar materials being provided to you soon after this presentation. And we, as those in healthcare, understand and appreciate how efficient we need to be with our time. So we're going to give the rest of your day back to you. And until then, we are wishing you a safe and terrific rest of your Tuesday. Thank you, everyone.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye.
Thank you.